We are seeing more supplies come into the country, but still still a bit of a trickle. 300,000 this week, 500,000 next week, and then we're starting to get into the millions a week. So are you prepared to take on more Pfizer vaccines, and what do you need?
Look, we're really excited to take on the Pfizer. It's been a little bit in the planning for a while. My practice is actually running a Pfizer clinic today, which is fantastic. But yes, the trickle of supply is still a trickle of supply. And really, realistically, if you look at the numbers, until October, we're not right up to the numbers that we, should be to be getting everybody rapidly vaccinated. And GPs just need to be supported in that as they sort of have to actually look at how do we do this with the numbers that are needed, with the protocol that has to be used for Pfizer to roll it out. So it's just be supportive of your GPs as they take it on, because it's been really tricky.
Indeed. And how many supplies are you getting a week? If it's combined AstraZeneca, Pfizer, what's that on average?
So supplies for us for AstraZeneca have been at the sort of the 150 per week number. After we started at 50, we've gone straight into 150 per week for Pfizer. So at the moment we can actually potentially do 300 vaccinations per week. But realistically, the AstraZeneca numbers demand has dropped for number ones. But what we are having to do now is we're just up to that 12-week mark of being able to have to do the rollout of the number twos. So we're flat out in terms of getting everybody fully vaccinated for AstraZeneca, trying to pull in as many as we can for the 60s and over, as well as now rolling out the Pfizer.
As you say, most of the supply won't come until October. We're expecting around 2 million a week then. Are you concerned about the rush on vaccines and the rush on appointments, about the workforce being able to cope with that increased demand, a spike in demand that we expect?
Look, there's no doubt there's a demand. So, for instance, our practice got inundated with phone calls last week, and we still are at the moment with people, finding out on the website that we are going to be a Pfizer site. We get an extra sort of 200 phone calls each day. Our phones can't cope with that. Our poor reception staff can't cope with that. And so it's been really difficult. And so it is a matter of trying to say, look, try and be patient, as difficult as it is with everybody who is keen to get vaccinated, wanting to access the vaccine. Understand it's a supply chain issue, and as the numbers come up, the access will improve. I would also hope that sort of some of the systems around how you book in become a little bit easier as well, because I know a lot of our vulnerable population is finding this really difficult, often without being able to really navigate the websites. It's hard for me, and I do it every day. Then I can only imagine if, some of my patients who are in their 70s and just don't actually have a smartphone or easy access. It's really difficult. So that they are reliant on.
You're describing a bit of ongoing chaos there in a rush on these vaccines at the moment. Yesterday, the New South Wales Health Minister described it as the Hunger Games in New South Wales. Is that right?
Look, I think it's probably a nationwide experience and not just New South Wales from my talking to colleagues around the place. So it is this, what's otherwise known as FOMO. You're worried that you're going to miss out. But also too, in Sydney, we're currently experiencing that fear of the Delta virus, which is much stickier, as they say, and easier to transmit from person to person in the community. And I think we're realising that unless we get vaccinated, it's just, lockdown after lockdown and people being blocked out and border restrictions. How long can you do that without just going completely loopy?
Yeah, look, we are getting different data through every day as to the effectiveness of the vaccine. It's good to see that the aged care, or 4 of the 5 residents in the aged care facility in Baulkham Hills were actually vaccinated, but we're just learning that a third aged care worker has now tested positive to COVID, Charlotte. Are you detecting a higher rate of vaccine hesitancy among those that do work in the healthcare system?
Look, I think healthcare workers need to understand the responsibility that they have of being vaccinated. As I've always said, this is not just about vaccinating yourself, it's about actually understanding that you need to protect yourself, you need to protect those around you, your workplace, and the rest of the community. And if you're a healthcare worker, you just need to be vaccinated. There are enough vaccinations out there to ensure that everybody who is a healthcare worker can access it. And I've been certainly part of facilitating that to happen. It's not okay. And whether or not I personally, what my beliefs are about vaccines, I can have that conversation. But if I'm going to work in that field, I just have to get vaccinated. The same with a number of other, parts of the community too, quite honestly. I'll be a bit out there with that. And so I just think it's reprehensible that we're having this issue in aged care, where we've had the conversations, for a very last few months. It's all been about the difficulty of, we can't just protect our elderly population by vaccinating them. We know that the infection coming into aged care homes is from the healthcare workers. It's not from their family members. It's from the healthcare workers. So get vaccinated if you're a healthcare worker, please, now.
Very good message indeed, Charlotte, and thanks so much for letting us take up some of your precious time once again. Appreciate it. Speak soon.
Thanks. Have a good day.